Hi, everyone. Welcome to our practice, Dr. Cindy Care. I just wanted to introduce you to this new device that we have called the Emsella chair. And I want to speak to my ladies out there, and you know yourselves. If you have ever peed after you sneeze, cross your leg, you know, because you're holding it when you're coughing, when you're sneezing, when you're laughing. If you use any incontinence pads or briefs, this video is for you. So after you have kids, often your pelvic floor muscles, they get very weak. And that can also happen as we age. It happens for a variety of reasons, but especially postpartum, you're told to do your Kegels where you're not even sure if you're doing it correctly because, you can't really teach it. They just tell you to squeeze those pelvic muscles really tightly for some time. And then you kind of have to do this repetitively. So a lot of us ladies, because of this weakened pelvic floor, we tend to have to deal with, you know, some wet undies occasionally, having to, take showers depending on how severe the accident was. So there are different kinds of incontinence. So there's the stress incontinence that happens when you sneeze, you cough, you laugh. There's the urinary, the urge incontinence where like when you have to go, you really absolutely have to go. You hear some water, it starts coming down. So we have a solution. It's non-invasive in our practice at Dr. Cindy Care. It's called this Emsella chair that I want to introduce you to. So what happens is that you sit on it fully clothed. You don't necessarily have to have anything inserted into the vagina or into the pelvic area. Very non-invasive. You sit on it for 6 sessions and you get significant relief of those symptoms that I talked about, and it lasts for 12 to 18 months. Anyone who has dealt with this sounds revolutionary, right? I just sit on a chair. I do this twice a week for 3 weeks, and I don't have to pee on myself. My God, tell me more. Okay. So thank you for listening. I'm going to demonstrate how we use it in the next video.